Do you know what one of the most amazing things is about mental health treatment, about mental health services at this point in time? It's that there are so many different types of therapies that people can use to try to improve their symptoms and make their lives better. In the past, there were not so many types of therapies. So people usually tended to do what we call talk therapy. They just spent a session talking in detail about what is going on in their life, what symptoms they're having, and even in the way, way, way back past in psychoanalysis, when that came into being, that was a lot about talking about early life experiences, uncovering a lot of those thoughts, feelings, the unconscious, and bringing that to life so that someone can understand how they are making the decisions that they're making today, why they're feeling the things they do today. Well, talk therapy, no doubt, has a role. There is a place for it. But there are many different types of therapies that can help. And today, when I talk about trauma and chronic stress, I'm going to talk and explain what this particular type of therapy is that's called somatic experiencing, which a lot of people report being helpful to deal with the symptoms that are associated with chronic stress, with trauma. Okay. Now, what is somatic experiencing? Somatic experiencing is a body focused therapy that was developed by a psychologist named Peter Levine. What is the overall idea behind this type of therapy, somatic experiencing? It is that trauma, having had the experience of trauma, isn't just something that lives in one's memory in the mind. Trauma doesn't just exist as a memory in the mind, it also exists stuck in the body until proper treatment can take place where the trauma can work its way through and out of the body. So, somatic experiencing says trauma, if left untreated, can get stuck in the body. And that is a lot of times what people report feeling. They report feeling that tension, that chronic stress, even depressed, anxious because of this stuckness of the trauma. All right. Well, of course, it makes perfect sense. If something is stuck, that there is not balance, that something is imbalanced in the body. And so the central nervous system, a lot of times, is unbalanced without proper trauma treatment. And so somatic experiencing aims to release some of that energy in a healthy way. What's especially interesting about Levine's work, this work of somatic experiencing, is the idea that there is a traumatic physiological response one has: fight, flight, freeze. All right. So, in the face of a trauma, the body automatically, in an alarm based way, goes into a response. Well, what happens if the body physiologically doesn't get to return itself to that state of balance and relaxation and calm, what we call homeostasis in mental health? If the body doesn't get to do that, then some of that energy, that tension gets trapped. So, this type of therapy is all about helping the body's central nervous system get to integrate itself again, get back to a place of safety where the body feels safe, at rest, alert, but calm. A good kind of alert, not hyper vigilant. The kind of hyper vigilant startle response, jumping at any sound that we see when the body is still in a traumatic response, when a lot of that energy hasn't gotten properly released. Now, one of the things specifically that somatic experiencing does that's different from talk therapy is it talks about the sensations. Somatic experiencing, if you go to a therapist who is able to do any kind of somatic work with you, they are going to be asking you to focus on your body's sensations. So, thinking about things like in a quiet moment when you try to get relaxed, maybe your hands, for example, are sitting on your lap, letting your mind realize, well, is there any tingling that you feel in the hands? What does the hand feel like? Can you feel any heat emanating within the hand? Is there any muscle tension in your shoulders, maybe in your body, in your chest? Doing a sort of scan like that. This is so different than old school talk therapy where someone would go in for a mental health session and talk about the trauma that happened and relive it in detail. Well, what happened is over time, after so many decades of talk therapy being done, some psychologists thought, well, you know what? We need to improve upon the old talk therapy. Maybe we need some new types of therapies that can focus more on the body. What is happening in the body? That some life experiences that cause negative symptoms that bring someone to needing therapy, maybe the answer isn't necessarily just talking so much about it, that talking about it is the way out, is the solution, talking in detail, but actually working through the body so that the body is the primary focus in somatic experiencing, for example, while talking about the experience is secondary. That is a major shift from how we used to think about talk therapy and the purpose of talk therapy. So, the idea is with trauma and chronic stress, yes, talking about it to a point, to an extent, can be helpful. But at some point, there is value in focusing on the body and helping a person understand how to ease that tension, that chronic stress in their body. Let me give you some examples of what somatic experiencing may actually look like in a therapy session so that you have a better understanding of really what it is. So here's an example. In somatic experiencing work, the therapist may ask the client, so can you tell me a little bit about the trauma that happened to you? Tell me what it involved. And maybe the individual will start to talk for a minute or two about what happened. Then, here is where you will see an example of how the somatic experiencing shows up, the intervention, okay? And it's this. Therapist says, can you tell me when you started to talk about that, what happened for you in your body? Did you notice any sensations in your body? For example, did you start to feel your face flush at all? They may ask the client, did you notice, for example, anything change in your chest, any tightness in your chest? What about any change in your breath? Did you notice your breathing change at all? Did it become shorter? Did it become longer? Did you notice your posture shift at all? Another technique that I think is one of the most brilliant, but also helpful techniques in somatic experiencing is this one. It's a concept called pendulation, like a pendulum, right? Like a pendulum swings. All right. And here's how pendulation works in somatic experiencing. So, as the individual is maybe trying to recall back a few details from a traumatic event that they're talking about. As they're talking, the therapist may stop them and say, now let's stop for a moment. Do you feel any tension? Do you feel any tension in your shoulders? And then the individual often, while they're doing this, will feel tension maybe in their shoulders or let's say in their chest. Okay, client says, yes, I did. I started to feel it. Maybe I felt it in my shoulders. Therapist then says, okay, and now tell me where your feet are. And then the client says, well, maybe one foot is on the floor and they've sort of crossed their legs, or maybe both feet are on the floor, and then they'll say that. But the point of that, there you see the pendulum. The therapist takes the client from a place in the body of discomfort where there is tension, and then shines a light by asking that question, by making them think about where their feet are, by making them realize, wait a minute, another part of my body that is attached, it's all a part of the same body, is actually in a comfortable response. So, in this way, the therapist helps to neutralize the body overall by shifting between areas of the body where the client feels discomfort and areas where they feel comfort, to again neutralize it and integrate it, as opposed to all of a sudden feeling overwhelmed by the one part of the body that does feel uncomfortable or does feel distress. In this way, the pendulum swings back and forth to neutralize, so that the client begins, when talking, when processing about that traumatic experience, they begin to feel more integrated, more balanced, and calmer. They don't have to respond in alarm or panic in talking about any of that traumatic experience, because they're working with their body to teach their body how to talk about that experience, how to remember it, but in a safe way. And then finally, one other technique that I'll share is used in somatic experience is when discussing a part of the traumatic event that does really trigger upset feelings, maybe sad, angry, maybe even rageful, or the opposite. It could trigger feelings of feeling shut down and numb, and maybe all of a sudden there's no affect on the client's face at all, as they brought back a certain traumatic memory. Well, in this case, what the therapist can do is say, all right, now what I want you to do is look around the room, let your eyes land on something in this room that feels safe and calming. Look around the room. Now, when you feel anxious or distressed and you maybe even wish you didn't have to talk about this trauma at all, just look at something in the room that makes you feel safe and calm. This is what we call orienting to safety, because it is that sense of safety that is going to be what is ultimately the most helpful for this individual. So that although the trauma happened in the past, what they realize, what they come to accept is that they're not in the trauma now, that now, in this moment, they are safe. This is a little explanation on somatic experiencing. Now, if you feel like any of this work could be helpful for you, if you call a mental health therapist and talk to them to see if maybe they will end up doing sessions with you, you can ask them, do you do any somatic experiencing work? I'll share one example. When I have received my own therapy as a client, because every therapist, I believe, should have therapy at some point in their life. But I have said at times, hey, will you do in this session at some point a body scan with me, so that I have, 2 or 3 or 4 minutes where the therapist will guide me through a body scan, because that is something that I find really helps me to just physically relax. So in that way, I practiced what I preached and asked a therapist to do that with me. You too, if you seek out mental health services, can ask for specific types of interventions if you think they'd be helpful for you. All right.